Okay, hi everybody. My name is Leanne McNall, and this is my presentation on wart removal procedure. And this is for primary care of the child too, with Dr. Christina Monero for our week 9 assignment. So, when is it appropriate to remove a wart in pediatrics? The two pictures that I have presented here. One is a common wart, which is the one that's on top of the child's finger. And then these other ones to the right are the common wart, which is, they're also called flat warts. I do not have a plantar wart on this picture, but it's usually on the bottom of the sole of the foot. But basically, a lot of pediatrics is watch and wait. And so the first thing that we would do if a child came in was to watch and wait, because most of them will resolve. It will take much longer without treatment, but a lot of them do resolve in children on their own. But it's most appropriate. There's 4 reasons. It's most appropriate when there's a social reason, either, the child feels uncomfortable with at school, or there's actually some functionality of like their hand or foot that's being compromised due to a wart, or there's discomfort. So those are 3 reasons as to why we would remove it. The other reason is if there is a type of wart that's resistant, so it keeps coming back. And that one we want to treat because it's not going away and it's taking much longer. Okay, so just some age-related considerations. So, like I talked about with the children, we do like to watch and wait. Most of the time, if a child presented with a wart for the most time, it should go away within 1 to 2 years spontaneously on its own. And then, it's different with adults because it can take up to several years or longer for wart to resolve without treatment. So we're always going to treat adults, but with kids, we do like to watch and wait because 2/3 of them will go away. And then also, we don't want treatment to be harmful or scarring. So we do like to use the liquid nitrogen, which is cryotherapy. But you want to use that on older kids, which we'll talk about later. So if you have like a 2-year-old, like cryotherapy might not be the best solution or treatment because that child, it will hurt. There's discomfort. And so that's something that these are some considerations before you decide to forgo treatment of a wart. So methods, how to remove a wart successfully. So the first line treatment for common warts is using topical salicylic acid and cryotherapy with liquid nitrogen, like I talked about. They can treat most warts. So the salicylic acid, the skin must be dry to apply it. You have to dry it, put it directly on the wart. And you should do this daily. Also, they talk about putting duct tape on the wart after putting the salicylic acid. You can do that every 48 hours. Some pediatricians say, yes, duct tape is great. Some, don't know, or the efficacy of it isn't shown through studies. So they don't say to do that. But I know Dr. Or Professor Serrani said that she does tell her patients to use duct tape. So it includes the salicylic acid on top of the wart. So best practice therapy is we want to combine the salicylic ointment along with cryotherapy. And then the child should come into the office every 2 to 3 weeks to get another liquid nitrogen treatment. And then the salicylic acid can be done at home. Sorry. So expected outcome and follow-up. So the PDNP, like I said, you want to follow up every 2 to 3 weeks after cryotherapy treatment, or if other treatment has been done in the office. Sometimes a blister can present 1 to 2 days after the liquid nitrogen. And if there's redness and itchiness around the wart, this means that it's regressing and which is good. So that's in remission. So you want to explain to parents that it's not just going to go away right away. Like it's going to take months and sometimes 1 to 2 years for these warts to go away. And that's expected management, even if we are using liquid nitrogen and salicylic acid or any other type of treatment. Okay, billing and coding. So according to the AAPC, these are the codes for depending on the type of wart that you're treating. And then we also in our clinical seminar, we talked about that most of the time when Professor Suriani bills, she will bill for a normal well visit. But then if she does use cryotherapy or if there's some sort of like management or procedure, she will use these codes to bill extra for the time that she spent doing the procedure. And then appropriate clinical practice guidelines. So like we talked about in the beginning, currently many providers are taking the stance of wait and watch for warts because it avoids adverse effects like the blistering and the burning and the discomfort that comes with cryotherapy. And some other pharmacological regimens. It's very widely accepted to use the cryotherapy and SA at home in between. And that's the best practice right now. Again, treatment of warts is subjective to each patient. So depending on who's walking in the door, if you're going to treat, a smaller child who has recurrent warts, or if they're near their face, or depending where they are and how old the patient is depends on what type of treatment plan you're going to pick. Yeah. And then these are all my references. So thanks for listening.